Senator Parks and I will sign a conference report that is the strike all to your House bill. All three of us are willing to consider any variation or proposal you have to amend the strike all that we sent to you. And it was my understanding y'all had some changes you wanted to make to that. And that's sort of what we're here to talk about.
Senator,
Mr. Chairman,
hold on if I may, Senator, if that's okay. With all due respect, that's not exactly the case. I gave you the agreement over the weekend that was reached, not in total, but about 75% of what the parties wanted. I gave that to you. I said there was two other provisions that were left remaining that had not been agreed to. You took it. I was under the impression that you were going to have a final draft of a compromise for us to look at and to confer. That was my understanding.
Is it, let's assume for purposes of argument that we could agree to this proposal that you gave to me, which I think had 5 changes. I do think there's a problem with the repealer in that it would repeal the entire law, which I'm not sure what we want to do. But at this point, I don't think we're willing to go beyond the other 4 changes that were in that bill. Do you want us to prepare a conference report that has those 4 changes? And
I think that would be in the best interest of everybody, not just, hold on if I may, not just me and you, but the conferees and all the publics, that will have something that we're looking at and we know what we're discussing.
okay.
Thank you.
well, wait, no, I mean, you're welcome to leave, but as Senator Brian has said, I'm not prepared to sign the conference report. However, I've made it clear from day one and through my votes that the companies and the employers in this state need relief via the ERISA exemption that the pharmacists 2 years ago agreed was fine to go into the bill. As I understand it, there's not yet an agreement to include that. So I would ask that that be included. Short of that, would be open to a severability clause, because it's been made clear through the Oklahoma case and others that ERISA will probably and most likely and does preempt in this case. So the severability clauses would take care of that. But if we're going to get a report, then I would encourage everybody to have that in there.
Thank you, Senator. That has more to do with the internal workings of the Senate and the conferees and the House. But as the Senate, as Hobb knows, in addition to the interests that we have been dealing with that have come to public and that we have had some type of an agreement, maybe about 75 to 80% of what has been at issue, the House is also taking into consideration and has the utmost importance about what will drive down costs at the same time, as we discussed. And that's a component that we need to address, hopefully, and something that we also need to consider.
But the cost, nobody, I asked during the debate on this bill, I asked, can somebody guarantee me that costs will go down if this passes as the way it is? And I got a 0 answer. Okay. In fact, I've been told that costs will go up, and costs for the 12,000 employees at Ingalls, for the thousands and thousands of employees at Toyota, for the thousands and thousands of employees at Ergon, the costs will go up, as I've been told, both from litigation costs, and they'll be passed on to the employees who are getting the benefit of the health and the prescription services. So I'm not prepared to vote for something that's going to raise costs of prescription drugs on workers in this state. Nobody's given me a definitive answer about that. It's easily solved by an ERISA exemption that the pharmacists 2 years ago in this building agreed to. It's really that simple. That's all we got to put in there.
The pharmacist agreed to what, Senator? Can you
Do
be?
an ERISA exemption along with a self-insured exemption for the hospitals. They did that right there at the podium when I made the motion here in this building.
Are they willing to go back to that position?
I would hope so, but I've heard that they're not willing to do that. I've heard that they've told the House that they're not willing to do that.
Mr. Chairman, can we verify that, please?
As of this point, I don't think the pharmacist and I don't think two of the Senate conferees are ready to agree to an exemption for ERISA. I don't know that I don't know what objection there would be to a severability clause. This is the first I've heard of that, but I can't see how that hurts anything. But what I'm trying to find out is there were 5 specific proposals in what we talked about Sunday morning. I have difficulty with repealing the entire act, including what's on the books now. But if you would like for us to consider those other 4 things, we'll do that. Is there anything else that you want us to consider? I hear there have been meetings with employers and with the EPAs. I had thought maybe some of that was being passed on to you. I was not at any of those meetings. Is there?
Neither was I, Senator. I was not privy to any of those meetings, nor did I receive any type of draft this morning, Senator.
Okay.
Question, Mr. Chairman, if you don't
Yes,
mind.
sir.
Gentleman from Jackson mentioned the fact that he was, it was amenable to a possibility of a severability clause or assumed non-severability clause.
If I could just interrupt,
Mhm.
he's not in the House.
No, that's
He's in
a
the
gentleman from
Senate.
Jack, I'm saying.
So I don't know that it's technically correct to refer to him as a gentleman.
Yeah, okay, I understand that,
It
but we're
it
going.
would be senator to you, certainly.
Well, no, well, that's up for debate.
You know,
It's up for debate.
They're all gentlemen
Yeah.
over there, but we've not
That's
declared
right.
ourselves to be.
No.
No, not y'all, it's up for debate and there's some question about that, but I want to understand before we depart here. Is your, position that you want a severability clause or non-severability clause to where you're going to put provisions in there if they all pass that, or they all fail? Is that what you're looking for, gentlemen?
Let me,
Almost like a jury trial. It's all or nothing sometimes, you know?
well, no.
What are you looking for, I guess?
As I understand it, and God knows I'm no expert on ERISA,
Mhm.
but I think preemption applies here. And so the question is, why not plan for that scenario should that be the case? My understanding is the pharmacists this year are objecting to the exemption clause for ERISA plans and companies. And my comment was, that's what I'm arguing for, and would ask the chairman to consider upon getting a conference report. But short of that, then to do something like you're describing.
Okay, thank you. It basically is a lot of risk associated with the position that you gain in some legislation sometimes is what you're saying, right?
Right,
Okay.
versus,
I just want to make sure where we are.
well, and right now we got,
Without looking at language, but you're saying sometimes you get what you ask for, but you don't get what you need, right?
that's right. And we got 4 hours, and of course we could not have a conference report at all. And then we're all back here where we were the last 3 years.
Mr. Chairman, thank you. Mr. Chairman, if I may make a recommendation to avoid the situation that the senator from Jackson just described, why don't you've got the language that I gave you about the consensus on the 5 changes that were made. Do you have any proposals, sir, about the 2 remaining issues?
No,
Do you want to make those 2 so that we can, and put them on paper so that we can take a look at those? Or how do you want to handle
I don't have any proposals
at all?
those issues.
Okay.
And at this point, I want to address one of the comments that was made by Senator Wiggins, and that was that he's been told that the costs will go up. I think if we look back in history in the states that there have been the reform passed, the costs have gone down. So neither one of us have any data to support either accusation. However, I also, we talk about language and changing language. I want to go back to several weeks ago whenever the House told us if we put these three things in, we will concur. I have if you tell us there's 5 new pieces of language today, does that mean if we put those in, you're going to concur? Are you going to go to the floor and pass this bill?
Lady, those 5 additional changes that we talked about, both sides have agreed to. We can agree to
We
those.
agreed to those other 3 a few weeks ago, that if we would bring it back with that language, that the House would concur. And we didn't see that happen. So what do we have today that says if we go and address 5 other pieces now, that you all are going to pass that bill? Why would we not look to the House to make those changes and provide them to us so that we now know where we would be?
I think it would be better if both sides propose those changes and that we can look at them together. And if I may, let me address your first statement that you made, lady, with all due respect, drug costs have not gone down anywhere.
We haven't passed reform yet either.
What?
And if you look in West Virginia, you
Other
look in
states
some-
have.
Yes, they have. And we have statistics and data that show that. We absolutely do. And so now is that, that is the whole idea and surmise behind, passing reform. One of the other things that I would say, we have choices and decisions that we need to make. We need to make those based on what's best for our constituents, what's best for the state. And those are things that I would bring us all back to. We can continue to support the big PBM in the room, and they're going to come at us hard, and they have. Or we can choose to help our citizens. And the bill that we had before, 1123, it didn't just help the local independent pharmacist. It also helped our citizens. And I live in a
Good,
small
sure,
town. I live in
lady.
a small rural town. I don't have a CVS. As you said a while ago, let me finish. We let you finish, okay? I don't have a CVS in my town. A lot of towns inside of Mississippi do not have those. My constituents would have to drive 45 miles, or they can choose mail order. But, I live in rural Mississippi, and not everybody in rural Mississippi wants to go with mail order. And today, unfortunately, my U.S. mail is not very secure, nor is it dependable.
Lady, I share your concern about the costs and your constituents back home. That's what I had been trying to address and come to a compromise with the 2 competing parties that we have also. The statement you made about taking on the PBMs, let me remind the lady that the House Insurance Committee, whenever I was chairman 7 or 8 years ago, was probably one of the first states to take on the PBMs and draft reform legislation concerning drug costs and drug pricing. We passed that legislation, as you know. I went to you personally for 3 years straight to have the Senate try to do something on reform. The Senate refused to take it up, not just once, not just twice, but 3 years straight. So I'm not afraid to take on anybody.
And can I ask a question about this bill in this conference report? I can get prepared a conference report. I'm not sure I can get signatures for it, but let's assume I can. That takes the bill you handed to me. I really think that the repealer language was better when it only applied to 2 sections, so I would propose to change that. It seems to me that no one should object to a severability clause. And I can get a conference report potentially prepared doing that. Is that something that it's worth me doing? Do you think that's something the House would agree to, or?
I think it would be worth taking your time to go ahead and prepare that
Okay.
and let us take a look at it. But what about the two remaining issues that I discussed with you? You're
The-
just going to
the
leave,
sta-
hold on, let me finish if I may. Are you just going to leave those blank or are you just going to not address them at all?
Not address them at all. The Senate position is the bill we sent to you, which was sent to the House after we were told by the House they would concur in that. I understand that there's a concern now to consider some other matters. Okay. And so there were four or five things you particularly asked us to consider. With that quirk to the uh, uh, repealer, I think the other four are worth considering, and I'll attempt to see if we can do that. But I think the short answer is the Senate does not have a proposal to backtrack on something we sent to you. So no, we're not going to have a proposal about what you say are the other two things. I'll listen to you, I'll listen to anybody, but our position is the bill we sent down there.
Well, you say that, Senator, but unless I'm misunderstanding you, you're going to send me a committee report with the 5 provisions that the parties agreed to, which is different from the original Senate language.
Because you asked us to.
Okay.
Okay. So I understand that you may not want to sign the conference report, may want to vote against it, may want to speak against it, and that's all fine. I had thought there would be other proposals, but they're not. So I'm gonna go get the conference report filed because we've got to do.
That's fine. But let me be clear. I support what, what Senator Parks and yourself about if we were told they were going to conference or concur and it didn't happen, I understand why we're here. And so I think that's a completely fair ask. But I was my vote has been clear throughout the history of this legislation and that's what I was simply asking for. But yes,
Okay.
I completely understand
And
that.
I'm glad you're here. I'll listen to anything you have to say, as you
Yeah.
know. Okay, but I'm gonna go see about that. And
Are we gonna, Mr. Chairman, are we going to likely schedule another conference committee?
I don't know that we'll have time, but
Such
I
as this.
think we need to start getting the drafting people to draft and go from there.
Sounds good.
Okay,
Thank you.
thank you. And I think Chairman Creekmore is around somewhere, and let's see where we stand on the Pharmacy Practice Act bill.